I am very thankful to our registrar Nasir Saab, who came along with guests and gave his precious time to us. Now, I would like to start the program, so I invite Mr. Shahabullah from 4th semester and Miss Amara from 2nd semester to come up on stage and start the program. Thank you.
Bismillahirrahmanirrahim. Assalamu alaikum wa rahmatullahi wa barakatuh. In the name of Allah, the most compassionate, the most merciful. Honorable Vice Chancellor, respected guests, respected deans, directors, faculty members, and my dear fellows. I am Shahabuddin from Surgical Department 4th semester.
I am Amara Vakil from Surgical Department 2nd semester.
Today, we stand before with utmost humility and gratitude as we gather here for a momentous occasion, that is, a global surgical day dedicated to knowledge, innovation, and healing. We are Muslims and we start this global surgical day function with the name of Allah, who is the King of the Kings and the Lord of the Lords. So I invite Muhammad Salman from 4th semester for the recitation of the Holy Quran.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم أقم الصلاة لدلوك الشمس إلى غسق الليل وقرآن الفجر إن قرآن الفجر كان مشهودا ومن الليل فتهجد به نافلة لك عسى أن يبعثك ربك مقاما محمودا وقل رب أدخلني مدخل صدق وأخرجني مخرج صدق واجعل لي من لدنك سلطانا نصيرا وقل جاء الحق وزهق الباطل إن الباطل كان زهوقا وننزل من القرآن ما هو شفاء ورحمة للمؤمنين ولا يزيد الظالمين إلا خسارا وإذا أنعمنا على الإنسان أعرض ونأى بجانبه وإذا مسه الشر كان يئوسا قل كل يعمل على شاكلته فربكم أعلم بمن هو أهدى سبيلا صدق الله العظيم.
Jazakallah. National anthem is the most valuable and respectable for every citizen. Ladies and gentlemen, I ask you that all of you rise and pay attention to the national anthem.
It is a day where we aim to explore the frontiers of surgical innovation and celebrate the remarkable advancements that have the potential to transform lives and alleviate suffering. I invite Qasim Shah for welcome speech to welcome you all.
Starting with the name of Almighty Allah, who is Lord of the Lord, the most merciful and precious. I am Muhammad Qasim Shah from Surgical Department 4th semester. Assalamu alaikum, ladies and gentlemen, and a warm welcome to our Honorable Vice Chancellor, Professor Dr. Salimur Rahman, distinguished guests who have graced us with their presence today, our esteemed Director, and all the esteemed who have joined us for this special celebration of Surgical Day. Today, we are here to celebrate a special day of our life, known as Surgical Day. It's a day which comes once in a year, and we have to celebrate it because to express the importance of surgical technologies to the society and scope of surgical technology in the field of medicine. We have a lot of students. They are going to explain what surgical is and what's the history behind the Surgical Day. So try to listen carefully. It will help you a lot to understand the surgical field because we are the allied health professionals. Forward, we have a lot for today, so be patient. And for the student of allied health department, we have very informative events in today's seminar. And at the end, I want to share some basic quotation with regards to our surgical department. That is, study hard until you can say, I am a surgical technologist. Everything is gonna be alright. We are studying to save lives. Only the healing art enable one to make a name for himself. But at the same time, they give benefit to others. Thanks to all of you for being with us on this precious occasion. Enjoy the day. Wassalam.
Now I would like to thank a special person. Without him, this function would not be possible. So I invite our focal person, Mr. Zarak Khan, to talk about the history of surgery.
As you know, surgery is not from now or today or from 2 years later or 3 years later. It's an ancient, from ancient time. So the very first of surgery was done by Shrusta. He was also known as founding father of surgery. His period is between 1200 BC to 600 BC. There is some evidence of trepanation which was done in 6500 BC. Trepanation was the practice of drilling or cutting a hole through the skull to expose brain. At this time, only around 40% of people survived after the procedure. This was thought to cure mental illness, migraines, epileptic seizures, and was used as emergency surgery after a head wound. In Islam, Abu al-Qasim al-Zahrawi is considered the father of operative surgery. He was the first person who done thyroidectomy. He has also invented over 200 surgical tools in the 11th century, which saved millions of lives. And today you can see the surgery is in another level. Today we have two types of surgery, open surgery and endoscopic surgery, which will be explained further by my students. Thank you.
Thank you, sir. To get a clear idea about operation theatre and operation theatre zone in hospitals, I invite Salman Khan from 2nd semester.
I seek Allah protection from the Satan rejected, starting by the name of Allah, who is the most merciful and beneficial. Honorable Vice Chancellor, respected guests, dear friends, Assalamu alaikum. My name is Salman Khan. I am a student of BS Surgical. Today my topic is about OT zones. Zones are used to manage traffic in OT rooms. We have divided into 3 categories zones. First one is unrestricted zone, semi-restricted zone and restricted zone. First, unrestricted zone, a type of a zone where OT personnel, patients are allowed in street clothes. Second, unrestricted zone. Unrestricted zone, semi-restricted zone. Second, semi-restricted after changing from street clothes and with the slippers enters in this area OT attires is attire is required. Last one is restricted. This zone has operating rooms where surgical procedures are performed. It is the completely sterile zones where patients and OT personnel are completely sterile. I am again very thankful to all of you to listen my shortcut presentation. Wassalam.
To recognize the importance of surgery, I would like to invite Muhammad Daniel from 4th semester.
Starting with the greatest name of Almighty Allah, who is the most gracious and the most merciful. Ladies and gentlemen, esteemed guests and fellow healthcare professionals, Assalamu alaikum. I am Muhammad Daniel from Surgical Department 4th semester of Sarhad University. Today I stand before you to emphasize the vital importance of surgery in our daily lives. So for this purpose, it is very important to knowing about first what is surgery. Surgery is the removal or repair of diseased tissue, organ, removal and obstruction or reposition of structure to their normal position. So surgery is a medical discipline has transformed the landscape of healthcare for countless individuals. Do you know why surgery is important? So listen, surgery is important because it is the last hope of life. Whenever there's come a condition which cannot be treated by any medicine or any other methods, then the last hope is surgery. As we all know that surgery not is an easy task for both patient and for personnel, but it is an important for life of individual. Moreover, surgery significantly improves the quality of life for countless individuals. Consider those who suffering from chronic condition or debilitating disease that impair the ability to carry out daily activities. Orthopedic surgery can restore mobility and allow individuals to run, work, and engage in activity they once enjoyed. Neurological surgery can relieve excruciating pain and restore neurological function. There are numerous types of surgery and each serving different purposes. However, I can provide you with information on two commonly and widely performed types of surgery. Number first one is open surgery. Open surgery refers to the traditional surgical approach where incision is made in the body to gain access to the target area. Surgeons use many tools and instruments by performing this surgery. Number second one is laparoscopic surgery. Laparoscopic surgery is also known as minimal invasive surgery, to which a small incision made and specialized surgical instrument, camera and also called laparoscope, are inserted to the body of patient. The camera provides magnified view of the internal structure, allowing the surgeon to perform procedure using video guidance. In conclusion, surgery is an indispensable component of modern medicine. It significant lives not only to saving lives, but also it contributes the overall betterment of society. And last, so surgery is a last hope of life. Thank you.
I invite Farishta and her team to come upon the stage and present Operation Theatre dress.
In the name of Allah, who is the most merciful, the Almighty, the Creator, the Protector, the Omniscient of the whole universe, respected chief guests, dear professors, respected deans, dear teachers and friends, Assalamu alaikum. Today, on the occasion of Surgical Day celebration, I am Farishta Mukhtiar from Surgical Department with my team members. Miss Ariba, Miss Iman, Miss Amara, Miss Khushnur, Miss Asma and Mr. Rahim. We are here to present the complete OT attire in official manner. OT attire is very much important for entering operation theatre because operation theatre is the area which is free from particles, dusts and other dangerous things. The OT attire has two main components, the clean attire and the sterile attire. The clean attire includes the surgical dress, the surgical cap and OT shoes. The sterile attire includes the surgical gown, surgical mask and sterile pair of gloves. Now I will invite my team members one by one to come on stage and present the different aspect of OT attire. So the very first, I am inviting Miss Ariba to come on stage and present the surgical dress. Please concentrate. This is the surgical dress which she had already changed in the changing room. The changing room is the area where street clothes are changed into surgical dress. This is half sleeve, collarless, buttonless dress, and each faculty has its own specific code for surgical dress. Now I am inviting Miss Iman to come on stage and present both the surgical cape and OT shoes. After wearing the surgical dress, the personnel has to change to wear the OT cape. The OT cape is very much important because the hairs are considered to be gross contaminated, so the head cover completely covers the hairs. The OT sandals are OT shoes. After wearing the head cover, the personnel has to wear the OT shoes. The OT shoes should be without back straps, made up of soft leather, must be well fitted and comfortable. Now I am inviting Miss Amara to come on stage and present the surgical scrub gown. After scrubbing the hands and drying the hands with a sterile towel, the personnel has to wear the surgical sterile gown. The sterile gown has a back open with 2 strings, which are to be tied by an assistant. Now I am inviting Miss Khushnur to come on stage and present the surgical mask. After wearing the sterile scrub gown, the personnel has to wear the surgical mask. The surgical mask is also important to prevent the airborne infections. The surgical mask has 4 strings, 2 above the ear on the head and 2 below the ear on the neck. Now I am inviting Miss Asma to come on stage and present the surgical gloves. After scrubbing and wearing the mask, the personnel has to wear a sterile pair of gloves. And the cuffs of the gown sleeves to be tucked inside the gloves cuffs. In the last, now I am inviting Mr. Arshad to come on stage with a complete attire. Please concentrate. Thank you so much for your precious time.
Today we have come together with a shared purpose, guided by the theme of Surgical Day. So I invite Shadab and his team to present the theme of Surgical Day.
Team of operation theatre is going to prepare for surgery. Surgical technologist is preparing the OT trolley. surgical first assistant and technicians have prepared the patient for the surgery. They have draped him. They are going to have appendectomy. The surgeon has arrived to the operation theatre. Now first he has to scrub his cell. The 7 steps to scrub his hands. First, the surgeon has to wear the gown. Circulating nurse is helping. The surgery is going to restart. Everything is okay. The case is looking very serious. Surgery is done successfully. Now the first assistant is going to stitch the patient. Surgeon has disturbed and now going out of operation theatre. He met the attendant.
Thank you, Shadab and his team. Equipment is the most important part operation theatre, so I invite Ataur Rahman for discussing the surgical equipment.
My name is Ataur Rahman from BS Surgical second semester.
I stand before you today to shed light on an essential aspect of modern healthcare that fall unnoticed but a crucial role in the success of surgical procedure and the advancement and significance of surgical equipments. Surgical equipments refers to the tools and devices used by healthcare professionals during surgical procedure to perform various tasks with precision and effectiveness. Surgical equipments play an important role in modern medicine, enabling more medical professionals to perform complex procedures to save countless lives. Here are some common equipments or their purposes. We will discuss. The first one is the anesthesia machine. Anesthesia machine is a vital piece of equipment used in medical setting to administer anesthesia to patients during surgical procedure and ensure the safe delivery of anesthetic gases and a effort to control patient level of consciousness and manage pain. While a specific feature and a component may vary different models. Here is a general overview and the function of typically found anesthesia machine such as gas supply, gas sources and pressure monitoring, and vaporizer and breathing circuit. And the second one is the operating room lights. Operating room lights are an essential component of any surgical setting, providing proper illumination for surgeon and surgical staff during procedure. They are designed to meet the specific requirements such as brightness, color temperature, and positioning flexibility. Here is a general overview of the function of operating room lights such as illumination control, color temperature adjustment, and shadow reduction. And the third one is the surgical table. Surgical tables are also known as operating table. It is important equipment found in the operating rooms. It serves a platform to support patients during surgical procedures. Modern surgical tables are designed with advanced features to ensure patient safety. Here are the key functions of surgical table such as patient positioning, stability and durability, weight capacity, flexibility and adjustability. And the last one, the electrosurgical unit. Electrosurgical unit refers to the range of medical devices that utilize electrical energy for cutting, coagulating, and modifying tissue during surgical procedure. These tools are widely used in various specialties including general surgery, gynecology, urology, and orthopedics, and many others. There are two types of electrosurgical units machine. One is monopolar and the other one is the bipolar. Thank you for your attention.
Surgery has an important role in rehabilitation. So now for explaining the role, I invite Jamal Khan from second semester.
Ladies and gentlemen, respectable teachers and dear guests. My name is Jamal Ehsan Khan from Surgical Department second semester. Today my presentation topic is related to the surgery. The term surgery refers to the range or extent of procedure and intervention that fall within the operation theatre. It encompasses the various areas of medical practices. The surgical department is broad and include multiple specialties and subspecialties. Here are some of the key areas within the department of surgical. First one is general surgery. General surgery encompasses a wide range of surgical procedure involving the abdomen, digestive tract, soft tissues, breast, skin, and endocrine system. General personnel often perform procedures like appendectomy, gallbladder procedure, hernia repair, and surgical treatment of various cancers. General surgery is a medical specialty that focuses on the surgical management of a wide range of diseases, injuries, and conditions. The second one is orthopedic surgery. Orthopedic personnel specialize in the diagnosis, treatment, and surgical management of conditions and injuries related to the musculoskeletal system. This includes procedures such as a joint replacement, fracture repair, and spine surgeries. These personnel work closely with other healthcare professionals, including physical therapists, radiologists, anesthesiologists, and rehabilitation specialists, to provide comprehensive care for the patient. The third one is cardiac surgery. Cardiac surgery, also known as cardiovascular surgery, is a specialized field of medicine that focuses on the surgical treatment of conditions affecting heart and blood vessel. It involves procedure performed on the heart, including the blood vessel and valve, to correct abnormalities, repair damage, or improve overall heart function. Thank you so much.
Now I would like to invite Kaisar Khan to introduce our guest.
Dear guests, Assalamu alaikum. I am Kaisar Khan from Surgical Department. With due respect, I would like to thankful for the presence at our Global Surgical Day. Ladies and gentlemen, now I am awaiting you about one of the most precious guests. But first of all, let me tell you a little history of him. He was born at Waziristan in 1953. He completed his MBBS in 1976 from Khyber Medical College and then a PRCS in 1984 from Edinburgh. In the same year, he was also a senior house officer in orthopedic at Pilgrim Hospital at UK. He achieved his surgical training certificate from PGMI Peshawar in 1999, and then from 2005, he was a consultant surgeon professor and head of a surgical department Khyber Teaching Hospital, and in 2013, he retired as a head of Khyber Teaching Hospital. So ladies and gentlemen, now I am inviting one of the most respectable guests, Professor Dr. Muhammad Aziz Wazir, to come on stage and aware the student about surgical technology.
I thought I will make for you a speech which will give you just a little information about how the surgery developed in the world and why it became essential to introduce surgery into treatment of patients. But you people are so aware of all these things, so knowledgeable that I don't need to talk to you about the old story of the surgery. But mainly, surgery developed just as a necessity. Otherwise, the medicine people were holding everything, and all the treatment of diseases was in the hand of physicians. But there were conditions in which a physician couldn't do anything. So surgery became a necessity, but it is a risky skill. So it is a risky art in which physical manipulation of human tissue is done to correct the situation. Initially, surgery was done by the barbers. In every area there will be a barber and who will be doing amputations, incision and drainage of abscesses. There couldn't be anything more done till very recently because there was no anesthesia. So a patient will be held by many people. 3-4 people will hold the person, and then you will do the chopping of a hand or finger. And those surgeons who were very fast were very appreciated because there was not enough time because of things. So for surgeons, the problem came. First problem was pain, and to relieve the pain of the patient and to do any procedure, you have to do something about the pain. This is why we developed anesthesia. Initially it was analgesia. Opium was used along with hashish in China about 4,000 years ago. and they were the one who were doing operations. In Britain, it came in 1700s. They started giving opium and alcohol to do an operation. So pain was our main enemy first. After that was the bleeding. How to stop bleeding? This is many people up till now dies because of bleeding. The reason is that very few people still know how to intervene in the bleeding. So in our villages, somebody has a minor injury to his femoral artery and they die on the way. So that was the main reason. And then we developed compression. Then we developed sutures and ligation of the arteries. And then we developed after that the power instruments like diathermy, like the ultrasonic dissectors, like the ligashores, and so on, very expensive instruments. I would like to tell you people that your basic training is very good, but you must concentrate because many of you will be going abroad and you must know what are the dangers of these instruments. And also for infection, you must read microbiology because what bacteria bothers us nowadays mostly is not tetanus. Although our initial danger was tetanus, but now it is the Staphylococcus aureus, MRSA. How to prevent MRSA? Everybody coming to theater or to the ward near a patient should wash their hands. You should not wear tie in the ward or in the theater. You should not wear white coat. This is prohibited now in Britain. A doctor is not supposed to wear white coat, not a tie, because they carry the MRSA. Now for infection, it is very interesting how surgeons prevented infection. Till the time of Lister, nobody knew that why the wounds get infected. And he was the first person to correlate the finding of the French microbiologist that maybe the cause of infection is bacteria. And you know this happened in 18th century. And Lister first developed to sterilize the instrument with phenol, carbolic acid, which is used to wash the floor. And then he started cleaning off skin with carbolic acid and spirit. After that, Lister came to the conclusion that we should avoid all the bacteria by aseptic surgery. So all important thing for infection was, first was antiseptic surgery and then aseptic surgery. What you are practicing here is aseptic surgery. Now, after the infection, then we got in 1952, the penicillin was used commonly. It was discovered early, but it was started using in 1952. So prophylactic antibiotic is another very important thing. One deficiency which I found in your these presentations of theater. Remember the consent of the patient. Unless you have taken informed consent from a patient nowadays, you can go to court and you can lose your registration. So you must do the informed consent. That is how the parts are that you explain to the patient, why are we doing this operation for you and what other operations are available. And then after that, you explain to them the complications of the operation. And if complication happens, what will we do with you? We will take you back to theater, we will give you transfusions and all this. Then after that, about his tissues. Can we use your tissues for biopsy? Can we use your tissues for research? All these are written in the informed consent. The other thing which you didn't do, which is routine nowadays by United Nations, when a patient is lying on a table, the technicians bring the notes of the patient, surgeon is standing, other assistants are standing, anesthetist is standing, and then they start reading about the patient. Name, you must check the name of the patient. Side of operation, you must check. All the mistakes are done, that they open wrong side, they cut wrong organs, and then all of you will be in court. And after that, after everything is checked, then the operation starts. Most of the time, long time is taken by the anesthetist because it has to be safe. If anesthetist is hurried up, patient get cardiac arrest, then there is no return. So you must do a full consent, all recognize the patient, and after that do the operations. Now the instrument you use was only diathermy. But nowadays, if any one of you works abroad, and many of you will be, inshallah, getting good jobs abroad. The reason is that there is great demand for technicians, medical technicians, only in Europe 25 million are required. So if those of you who are really trained well, they will get jobs, but you must concentrate on these skills. In Pakistani hospital, all these things many of them are just left by the staff, and that is why there is so dirty instruments, so much dirty tables, so much dirty trolleys, everything is, nobody cleans them. This is your duty, that if you are in charge of a theater, you must clean all the fixed things like operation table, trolleys, anesthesia machine, diathermy machine. All these things is your duty. If you are trained in this well, you will be respected and you will be always taken anywhere. I am very impressed with your training, but you must concentrate on this. Also, the minor repairs of the instruments, you must know. And also you must know how to intubate in time of emergency. These skills you can learn very easily in theater from anesthetist. Now the future. Remember that this is very good that they are giving you a degree. The salary of a technician in Middle East and America, Canada, Australia, United Kingdom and Europe are much higher than the ordinary technician. But you should concentrate on all these basic points so that you give good name to this nation. Also in Pakistan, when you are in charge of a theater, you must, why the English hospitals are so good? Because the nurse in charge is so powerful that he can ask the consultant to wear proper clothes, to wear proper gloves, not to enter the theater. So she is all in all, and she keep the standards. So you should also develop, don't be afraid of anybody, develop the standards and press it on people. Those people who are using theater, because it is very important. If one get infection like tetanus, like staphylococcus MRSA, they are exposed to a lot of difficulty post-operatively. Many of them may die from this. So it is very important. Now, bacteria you don't see, but they are number one enemy of surgeons. Okay? There are many more points. I think one thing is that concentrate on your English also. Because all over the world when you are going, you must know English. Because you may be a very good technician, but they will not take you unless you know English. Right. Okay, this is all I wanted to say to you. No, the rest is, I am very, very impressed from your faculty who taught you these things, and the standard you are keeping is very good. Thank you.
Thank you so much, sir. Now I invite Dr. Ehsanullah Khan Marwat, neurosurgeon, who born in 1977 in Lucky Marwat. He have done his MBBS from Ayub Medical College and neurosurgery training from PIMS Islamabad. He also have done his neurobio training from America. Come, sir, and share a few words with us.
It's a really great honor for me to be at this stage with a legendary surgeon and in such a lovely gathering. I will talk in Urdu so that my messages get through to the students. I have been told that second and third, fourth year technology students are sitting here. Global Surgical Day. जैसे लेजेंडरी सर्जन साहब ने सब कुछ बता दिया, मैं दो पॉइंट्स पर बात करूंगा. एक ये कि जो हम सर्जिकल केयर करते हैं उसके जो रियल हीरोज़ हैं वो सर्जिकल टेक्नोलॉजिस्ट हैं. और सेकंड पॉइंट, बीमारियों की 4 लेवल्स हैं. पहला लेवल जो होता है हम प्रिवेंटिव मेडिसिन पर करते हैं. प्रिवेंटिव में हम अपनी सेहत का ख्याल रखते हैं कि हम सेहतमंद रहें, डाइट वगैरह का ख्याल रखते हैं, वर्जिशें करते हैं कि हमें बीमारी वगैरह ना लगे. सेकंड लेवल, जब इनसे बात न बने तो थोड़ी सा हम सप्लीमेंट्स ले लेते हैं, जिससे माइक्रो न्यूट्रिएंट्स वगैरह हमें नहीं मिलते तो हम वो ले लेते हैं, मल्टीविटामिन्स वगैरह, ताकि जो डिफिशिएंसी है वो पूरी हो जाए. जब उससे भी बात नहीं होती तो तीसरे लेवल पर हम आ जाते हैं मेडिसिन में. तो फिर मेडिसिन में 2 किस्म की मेडिसिन है. एक आर्जी इलाज होता है, एक लाइफ लॉन्ग लेनी पड़ती है अमूमन. और थर्ड स्टेज पर फिर जिस तरह आप लोगों ने लिखा हुआ है, सर्जरी इज़ द लास्ट होप. फोर्थ स्टेज पर, सॉरी, आखिर में जब आ जाते तो हम फोर्थ स्टेज पर आ जाते हैं, जिसमें बिल्कुल आखिरी स्टेज होती है. फिफ्थ स्टेज में फिर कीमोथेरेपी वगैरह होती है, लेकिन सर्जरी इज़ द लास्ट होप फॉर एनी पेशेंट. अब आगे चलते हैं. फॉर सर्जरी में 4 किस्म के बर्डन होते हैं पेशेंट पर या पेशेंट के केयर गिवर्स पर. एक साइकोलॉजिकल होता है, बड़ा सर्जरी, आप किसी के कोई आर्गन काटते हैं. सेकेंडली फिजियोलॉजिकल होता है, आप किसी आर्गन को काटते हैं, डेफिनेटली काफ़ी पेनफुल प्रोसीजर है. थर्ड, फिजिकली पेनफुल. एंड फोर्थ, फाइनेंशियली. सारे बर्डन, काफ़ी डिस्ट्रेस में होते हैं मरीज. अब वो आते हैं, जो ही एडमिट हो जाते हैं हम डायरेक्ट आ जाते हैं सर्जिकल ओटी की तरफ. ओटी में जो टीम होती है, सर्जन, एनेस्थेटिस्ट, सर्जिकल टेक्नोलॉजिस्ट, क्या करते हैं. मैं मिसाल दूंगा न्यूरोसर्जरी के पेशेंट की. एक्स्ट्राड्यूरल हेमाटोमा. एक्स्ट्राड्यूरल हेमाटोमा में हमारे पास ऑप्शन सिर्फ 2 होते हैं, या 100% रिकवरी या 100% मॉर्टेलिटी. जो दरमियान वाली स्टेज है वो सर्जिकल टेक्नोलॉजीज के अच्छे और जो स्किलफुल होते हैं वो मैनेज करते हैं. किस तरह, जो ही मैं ओटी में जाऊंगा, सर्जिकल टेक्नोलॉजी जो ओटी को रन कर रहा होता है, इंचार्ज होता है, अगर वो स्किलफुल होगा, नॉलेजेबल होगा, उसको पता होगा कि मैंने किस तरह ओटी को क्लीन रखना है, साफ़ रखना है. पहला मेरे जो पेशेंट का कंटेक्ट होता है वो मेरे लिए टाइम को ख्याल रखेगा फ़ौरन, तो वो सर्जिकल टेक्नोलॉजी. सेकंड स्टेज पर स्टेरिलाइजेशन वगैरह की जब बात आ जाती है, अगेन सर्जिकल टेक्नोलॉजिस्ट, अगर वो नॉलेजेबल होगा, स्किलफुल होगा, तो वो स्टेरिलाइजेशन का ख्याल रख सकेगा. ट्रॉली वगैरह जिस तरह अभी आप डेमो में दिखा रहे थे. थर्ड स्टेज पर सर्जरी शुरू होती है. फिर मेरे पास कौन होता है, जो असिस्ट कर रहा होता है सर्जिकल टेक्नोलॉजी को, उसको असिस्ट कर रहा होता है सर्जिकल टेक्नोलॉजी. जो टीचिंग इंस्टीट्यूट में होता है वहाँ पे मेडिकल जो ट्रेनिंग डॉक्टर्स होते हैं वो भी साथ में होते हैं, लेकिन फिर भी सर्जिकल टेक्नोलॉजिस्ट होता है. मतलब मिनिमम 3 सर्जिकल टेक्नोलॉजीज एक सर्जरी में इन्वॉल्व होते हैं. एक सर्जन, एक एनेस्थेटिस्ट, 3 सर्जिकल टेक्नोलॉजी. हीरो कौन हुआ, सर्जिकल टेक्नोलॉजी. एक रेशो 3 से. अच्छा, अब ये सारे जब नॉलेज वाला होगा, स्किलफुल होगा, तो अगर वही एक्स्ट्राड्यूरल हेमाटोमा टाइम पर हुआ, मुझे इन्फेक्शन नहीं हुआ, उसके बाद मरीज़ तय से जाएगा वार्ड में. वार्ड में फिर कौन होगा, उसकी ड्रेसिंग का ख्याल कौन रखता है, सर्जिकल टेक्नोलॉजिस्ट. उनको अगर वो नॉलेज वाला होगा, वो सही प्रोटोकॉल से उसकी ड्रेसिंग करेगा, इन्फेक्शन के चांसेस कम होंगे. अगेन पेशेंट डिपेंड, किस नर्सिंग रोल को कभी हम इग्नोर नहीं कर सकते. मैडम, वार्ड में केयर कौन करता है, उसकी प्रॉपर ड्रेसिंग, प्रॉपर उनको पेनलेस उनकी केयर, सर्जिकल टेक्नोलॉजी. आगे चलते हैं. ہم یوزولی 5 to 7 days میں ان کو ڈسچارج کر لیتے ہیں. گھر جاتا ہے 14 days تک اسٹیچز رہتے ہیں. کیئر کون کرتا ہے وہاں پہ؟ ڈریسنگ اور ان کے صحیح انفیکشن سے بچانے میں رول کس کا ہے؟ سرجیکل ٹیکنالوجیز. او ٹی سے لے کے گھر تک آخر تک سرجیکل ٹیکنالوجی سے مریض کا واسطہ رہتا ہے. جتنا نالج والا ہوگا اتنا زیادہ مریض کو فائدہ ہوگا, اتنا سائیکولوجیکلی, فزیولوجیکلی, فائنینشلی اینڈ فزیکلی مریض جلدی آئے گا. اب اس کو ذرا الٹا کر لیں. خدا نخواستہ فرض کریں ایک سرجیکل ٹیکنالوجسٹ ہے, اس کو پتہ ہی نہیں ہے کہ کیا اسٹریلائزیشن کے کیا ٹیکنیکس ہیں, کس طرح ہم نے خیال رکھنا ہے. یہ ساری چیزیں الٹی ہو جاتی ہیں, لائف لانگ ڈسیبلٹی ہوتی ہے. ہمارے سیٹ اپ میں کیا ہوتا ہے یوزولی سر ود ڈیو رسپیکٹ, اکثر او ٹی میں تو اسموکنگ وغیرہ نہیں ہو سکتی, تو ہمارے اکثر جو سرجیکل ٹیکنالوجسٹ صاحبان ہوتے ہیں وہ نسواری ہوتے ہیں یوزولی. تو وہ ادھر ٹرالی دھو رہے ہوں گے, ادھر بس پھینک دیتے ہیں نا. یو ہیو ٹو بی ویری اسٹرکٹ اباؤٹ دیز تھنگس. اچھا, لائٹر نوٹ پر کبھی کبھی یہ ہوتا ہے سرجن تھوڑی سی بات کر لیتے تو وہ ٹرالی دھو رہا ہوگا تو وہ تھوڑا سا ٹیکنالوجی غصہ ہوگا, تو اکثر پھر وہ دوسرے دوست کو کہتا ہے ہلکا دماغ میں چر لے گی ریوے چونٹے نسوار ہو میں اولا, تو ادھر ٹرالی دھو رہا ہوگا. تو یہ مریض کے جو آخر میں آؤٹ پٹ ہوتا ہے یا آؤٹ کم ہوتا ہے اس میں کافی افیکٹ ہوتا ہے. آپ کو ان چیزوں کا خیال رکھنا پڑتا ہے. یہ تو آپ صرف یہ میرے خیال میں آپ سب ابھی ایگری کریں گے کہ سرجیکل ٹیکنالوجیز آر دی ٹرو ہیروز ان اینی سرجیکل پروسیجر. اب بنتے کس طرح ہیں, کس طرح آپ ایک جو اسکلفل سرجیکل ٹیکنالوجسٹ ہوگا اس کے پاس کیا ہونا چاہیے؟ پہلے نالج ہونا چاہیے. نالج کے لیے کیا ہونا چاہیے؟ آپ کو پڑھنا ہے, آپ کو ریگولر ہونا ہے, آپ کو کلاسز میں یا آپ کا جو پریکٹیکل ورک ہے. تو میں سائنٹیفکلی پروون 3 طریقے بتاؤں گا جو میرے لیے, آپ کے لیے, سب کے لیے 3 طریقے انٹرنیشنلی ایز اے نیورو بایولوجسٹ جو ہمارا برین کام کرتا ہے, جس طرح وہ سیکھتا ہے, کس طرح آپ جلدی سیکھ سکتے ہیں, کس طرح آپ اس نالج کو اپلائی کر سکتے ہیں. ہم سب کے لیے 3 چیزوں پر کوئی نان نیگوشیبل 3 چیزیں. فرسٹ, ارلی رائزنگ, اسپیشلی جو ایز اے نیورو بایولوجسٹ آپ کو بتا سکتا ہوں کہ جو سورج کی جو شعائیں ابھی تک پیلی ہوں 10 to 30 منٹس تک, اسپیشلی ہم بینگ اے مسلم ہم سب کو چاہیے صبح نماز کے لیے اٹھیں, لیکن اس کے بعد اب اس میں کیا ہوتا ہے, کیوں یہ کہہ رہا ہوں, اس میں ہمارے ہارمون جو ہمارا برین کام کرتا ہے ایک مشین کی طرح. جس طرح گاڑی میں آپ کو موبلائز چاہیے, ڈیزل یا پیٹرول, بریک سب مل کے ایک ایفیشینٹ کار فنکشن کرتے ہیں نا مشین. اسی طرح ہمارے جو برین میں صبح کارٹیسول یہ ریلیز ہوتا ہے, ڈوپامین, سیروٹونین, نارپینیفرین, ایپینیفرین, ایسیٹائلکولین. اب یہ ساری چیزیں کیمیکلز مل کے ہی ان سے ہم دین کا آغاز ہوتا ہے, ہمارے جسم کو سیکھنے کے لیے تیار کرتا ہے. کارٹیسول کیا آپ لوگوں نے سنا ہوگا, وہ اسٹریس کرتا ہے. اسٹریس صبح کا جو کارٹیسول ہوتا ہے وہ آپ کا بینیفیشل اسٹریس دیتا ہے, آپ کے جسم میں قسم کا ہجان سا پیدا کرتا ہے کہ آپ نکلے کچھ کریں. ساتھ میں ڈوپامین ہوتا ہے. ڈوپامین کیا کرتا ہے, آپ کو موٹیویٹ کرتا ہے کہ آپ کے جو گولز ہیں, آپ کے جو کچھ سیکھنے کی چیزیں اس کے لیے آپ نکلے, محنت کریں, نکلے. تو اس وقت ساتھ میں ایسیٹائلکولین کیا کہتے ہیں, جو بھی چیز آپ کر رہے ہوتے ہیں یا سیکھ رہے ہوتے ہیں وہ اس کو ایک قسم کا اسٹیمپ, جس طرح ہم کوئی امپورٹنٹ ٹاپک یا سینٹینس ہوتے ہیں اس کو انڈر لائن کرتے ہیں یا ہائی لائٹ کرتے ہیں, اس طرح وہ اسٹیمپ لگا دیتا ہے سیکھنے کے لیے. مسٹ ہے, ضروری ہے کہ آپ پھر اس کے بعد جب آپ کالج جائیں گے تو ساتھ میں سیروٹونین نکلی ہوتی ہے, وہ آپ کو موٹیویٹ رکھتا ہے, آپ کو آپ کی خواہش ہوتی ہے کہ آپ کچھ سیکھ لیں, آپ کچھ پڑھیں. آپ جب کلاس میں آتے ہیں فریش ہوتے ہیں, آپ کو سیکھنے کی جستجو ہوتی ہے. ڈوپامین اور سیروٹونین دونوں مل کے آپ کو آگے پش کر رہے ہوتے ہیں مسلسل. اس کے بعد جب آپ کی کلاس وغیرہ ختم ہوتی ہے تو اس میں تھوڑی سی پھر ایڈینوسین ایک اور کیمیکل ہے وہ بڑھ رہا ہوتا ہے, تو تقریباً کلاسز 30 to 90 منٹس نیپ جو کیلولا کہتے ہیں وہ اگر آپ لیتے تو وہ جو ایڈینوسین آپ کو نیند کی طرف لے جاتی ہے وہ تھوڑی سی ہٹ جاتی ہے. آپ کے دماغ میں جو آپ نے سیکھا ہوتا ہے وہ ریپلے ہو جاتا ہے, اس کی ریویژن ہو جاتی ہے. آپ سو رہے ہوتے ہیں لیکن وہ ریویژن ہو رہی ہوتی ہے. جو ہی آپ اٹھے, اب میں یوزولی 30 منٹس ضرور لیتا ہوں کیونکہ جو میں نے کچھ سیکھا ہوتا ہے تو وہ اس وقت پھر ریپلے ہو رہا ہوتا ہے میرے دماغ میں. اچھا, آپ فوراً بیٹھ جایا کریں تقریباً عصر تک یہی ٹائم ہے آپ کے پاس کہ جب آپ نے پھر پڑھا ہوتا ہے, آپ کا ریپلے ہو چکا ہوتا ہے, دماغ فریش ہو چکا ہوتا ہے, ایڈونیسن سیٹ پر ہو چکا ہوتا ہے, دوبارہ ایک کارٹیسول نکلی ہوتی ہے, وہ آپ کو سیکھنے میں اور اسیٹائلکولین میموری بڑھاتی ہے. اس کے بعد ایکسرسائز نان نیگوشیبل, کوئی کمپرومائز نہیں ہے, نہ ایکسرسائز کوئی کمپرومائز نہیں. سیکنڈ جو پوائنٹ ہے اسٹوڈنٹس کے لیے, عصر سے مغرب کا جو عرصہ ہے زبردست ہے. کیوں؟ ایک تو فزیکل فٹنس وغیرہ اس کے ساتھ, لیکن جو سب سے امپورٹنٹ جو ایز اے نیورو بایولوجسٹ آپ کو بتا سکتا ہوں, جو ابھی بہت کم ہمیں پڑھایا جاتا تھا, BDNF. ایک یہ برین کا ایک جس طرح فرٹیلائزر ہوتا ہے فصل کے لیے, جو کھاد ہوتی ہے ہم فصل کو دیتے تو وہ صحیح گرو کرتا ہے. تو برین ڈیرائیوڈ نیوروٹراپک فیکٹر, یہ ہمارے برین کو ہیلدی رکھتا ہے, ان کو گرو کرتا ہے, ان کو نیورونز بنائے, نیوروجینیسس کہتے ہیں میموری سینٹر میں. جب آپ کا وہ ریلیز ہوتا ہے آپ کی یادداشت بڑھتی ہے, میموری, آپ کا اٹینشن اسپین زیادہ بڑھتا ہے, آپ فوکس کر سکتے ہیں کسی چیز پر. برین ہیلدی رہتا ہے تو آپ کی اگر میموری سے آپ لرننگ کر سکیں گے, آپ صحیح کسی چیز کو سیکھ سکتے ہیں. اور سیکنڈلی آپ کا انکیفیلینز اور اینڈارفنز وہ آپ کو موٹیویٹ رکھتا ہے, کافی پین لیس, آپ کو پین کم فیل ہوتا ہے. اس کے بعد پھر تھرڈ اور نان نیگوشیبل, نیند, سلیپ 6 to 8 hours مسٹ, 6 to 8 hours. اور سلیپ سے پہلے تھوڑا سا یہ موبائل کو اگر کنٹرول کر لیں. کیوں؟ یہ جو آپ کلاسز میں آتے ہیں اور ادھر جو ہم سیکھتے ہیں, تو یہ لرننگ کا فرسٹ گیٹ ہے کہ آپ کا ایک قسم کا دروازہ کھل گیا, آپ اندر آ گئے, آپ کے دماغ میں چیزیں آ گئی. جو کنسالیڈیشن ہوتی ہے, جو آپ کی میموری بنتی ہے, دماغ میں رہتی ہے, یا جو آپ جو پروسیجر سیکھا ہوتا ہے یا جو بھی کچھ ہوتا ہے وہ سلیپ میں ہوتا ہے. اس کو ریسٹ مل چکا ہوتا ہے, باقی وہ بلڈ فلو زیادہ ہوتی ہے ان کے پاس, باقی جسم ہمارا پیرالائزڈ ہوتا ہے عموماً. تو وہ جو چیزیں ان کو چاہیے ہوتی ہے ان کو ریٹین کرتا ہے, جو نہیں ہوتی ان کو ڈیلیٹ کرتا ہے. جس طرح آپ کے میموری کارڈ ہے یا موبائل میں آپ کوئی چیز, آپ کی میموری فل ہو گئی, آپ کیا کرتے ہیں, جو کوئی نئی چیز فائل ڈاؤن لوڈ کرنی ہے آپ کو, تو آپ کیا کرتے ہیں کہ جو انوانٹیڈ چیزیں ان کو ڈیلیٹ کرتے ہیں, تھوڑی سی اسپیس بن جاتی ہے, وہ آپ پھر ڈاؤن لوڈ کر سکتے ہیں. اسی طرح میموری, سلیپ میں میموری کنسالیڈ جو آپ نے سیکھا ہوتا ہے اصل میں اس وقت وہ سالیڈیفائی ہوتا ہے. ٹھیک ہے. دوسرے دن کے لیے آپ کو جو انوانٹیڈ چیزیں ان کو نکال دیتے, تو ان کو دوسرے دن کے لیے آپ کو لرننگ کے لیے اسپیس کریٹ کر دیتے ہیں, آپ کے برین میں اسپیس ہوتی ہے. یہ 3 چیزیں نان نیگوشیبل. دوبارہ بتا دوں, یہ کسی بھی اسٹوڈنٹس کے لیے, میرے لیے, آپ کے لیے, سب کے لیے. ارلی رائزنگ مسٹ, جو بھی کریں صبح 10 سے 30 منٹ تک, یہ جو زرد یلو جو لائٹس ہیں سورج کی, اور عصر کے وقت جو سورج ڈاؤن ہو رہا ہوتا ہے, مسٹ ہوتی ہے. ایکسرسائز, فزیکل فٹنس مسٹ. ایک ٹون نکالی ہوئی ہے میڈیکل سرجیکل ٹیکنالوجی, کیا وہ نیورو سرجری کے 5-6 گھنٹے کے سرجری میں کیا وہ کڑا رہے گا. آپ کی فزیکل فٹنس مسٹ, آپ کے ایستھیٹک آپ اچھے بھی لگتے ہیں, پلس BDNF آپ کے برین کی فرٹیلائزر, یوریا, کھاد وغیرہ. اور تھرڈ سلیپ, جس میں آپ کی میموری بنتی ہے. تھینک یو سو مچ فار گیونگ می دس اپرچونیٹی. تھینک یو سو مچ. ٹیک کیئر.
Thank you, Dr. Ehsanullah Khan Marwat. Now, Dr. Nadir Shah, who born in 1985 in Waziristan, he have done his MBBS from Khyber Medical University in 2010. From 2011 to 2014, he was working in UK as a surgical resident. He has done his FCPS in surgery from HMC in 2019. Sir, please come up on stage and share a few words with us. Thank you.
Thank you. It's a pleasure to be here in the company of the teacher of the teachers, Professor Aziz Wazir. Let me tell you that he is my teacher as well. He was my first supervisor when I started working in the surgical department as a trainee. So he was my supervisor. I have learned a lot from him. It's an honor to have him in this hall. Thank you, Dr. Ehsan, Dr. Ilman Shah, Dr. Amir Aziz, and all the guests, all the students. Assalamu alaikum. Just a few talks regarding the same presentation which we did this morning let me tell you, this was an excellent presentation by the students, and I congratulate the teachers who have prepared them this way, because this is in the very beginning you did this. This is wonderful. Just a few things to make it more perfect, and as a coincidence, let me tell you, it's by chance that first time this happened that today, this morning, I operated 2 appendectomies. I did 2 surgeries this morning and both were appendix. One I did with laparoscope, and the other one of my students was doing, and she asked me to help her because it was a difficult one. So I just helped her in open appendectomy. And here when I saw you people doing this, I just recalled the OT. I thought that actually I am again standing in that OT and everything was going the same way. So this was so natural. With time, inshallah, you will learn a few. Professor Aziz Wazir Saab, my teacher, and Dr. Ehsan Saab, they have talked wonderfully regarding the history, regarding the sterilization, regarding the meaning of surgical technician, their job description. That was, I think, enough. Few things, just I will take just 5 minutes, not more than that. Here, like a few small things, like Professor Aziz Wazir Saab told you that before going for any procedure, the first thing is to take the consent, right? Consent means in Urdu, मरीज से इजाज़त लेना, उनसे, उनकी फैमिली से और फैमिली में किसी बालिग मेंबर से ऐसी इजाज़त लेना, consent, that you explain the whole procedure to them. You tell them that we are doing this surgery and these are the other options and these can be the outcomes, good and bad. Tomorrow, whatever happens, then the patients will not blame you that much. God forbid, in this surgery, whether it's a minor or a major, when you give anesthesia, there is every chance then the patient can expire, always. So you have to keep in mind those things. As a surgical technicians, you have to look after all those things which are happening before surgery, during surgery, after surgery. Of course, the nurses look after the patients. And let me tell you the difference between a perfect center, a very good center, and a bad center is only the paramedical type of things. The post-op nursing care, during operation and pre-operative. Suppose a high caliber person like Professor Aziz Wazir Saab, he performs a surgery, but by a small mistake, a small infection due to a mistake of a surgical technician or a nurses, a small bacteria enters into that wound. That gets infected, the patient gets operated again and again and again. Even many times it happens that the patient expires because of the infection. Then people will say that this patient expired because of the mistake of Professor Aziz Saab. Actually, if that bacteria was not introduced by the paramedical staff, it was a successful surgery. But due to that small, he did perfect surgery, he did everything perfectly. But due to that small mistake, patient expired. Now you can imagine how important this paramedical staff is, how important the job of a surgical technician or the job of a nurse is. 2-3 weeks back, I have got a video in my mobile. I operated a patient, Afghani patient who came from Afghanistan. You will not believe. Anyone who is interested, after my presentation, I can show you the video. I removed about 1 meter long gauze cloth from her stomach. एक गज कपड़ा उसके मैदे से मैंने हटाया और उस औरत में 7 years से पड़ा हुआ था. She was operating in Afghanistan और वो कपड़ा उधर रह गया था. अब यहाँ पे सर्जिकल टेक्नीशियन या नर्स का काम कहाँ पर है? हम जब सर्जरी करते हैं, काउंटिंग ऑफ द पेग्स, दिस इज द जॉब ऑफ द नर्स. In the OT, one nurse is standing and she just counts the number of pegs. And at the end of the surgery, the nurse asks the surgeon that I have given you 8 pegs and I want 8 pegs. जब तक नर्स सर्जन को इजाज़त नहीं देगी, सर्जन उसको क्लोज नहीं कर सकता. OT टेक्नीशियन जो वहाँ पे रिस्पॉन्सिबल होता है, सर्जिकल टेक्नीशियन, जब तक वो सर्जन को इजाज़त ना दे, वो कहेगा, सर्जिकल टेक्नीशियन या सर्जिकल नर्स जो भी होगी, वो कहेगी कि मुझे 8 पेग्स चाहिए. अब सर्जन का काम है कि वो कहीं से भी ढूंढेगा या अपनी मिस्टेक करेक्ट करेगा, उसको ढूंढेगा. अगर वो ना ढूंढे, उसको क्लोज नहीं कर सकता. इस तरह अगर परफेक्ट तरीके से ये होंगी, कभी ये मिस्टेक्स नहीं होते. So you can imagine how important these paramedical staff, surgical technician. This is a wonderful advancement in the society, mashallah, over the last few years. BS and these paramedical staff, colleges are increasing day by day, and believe me, even now we need them so much. I daily operate. कल मैंने 4 ऑपरेशंस किए कल रात को. जिस ऑपरेशन में मैं करता हूँ शायद बाकी सर्जन वो भी करते होंगे, वहाँ पे मेरे पास असिस्टेंट नहीं होता. ट्रस्ट मी, आई ऑपरेट पेशेंट्स इन वन हेडक्वार्टर ऑपरेशन हॉस्पिटल. वहाँ पे जब मैं जाता हूँ वहाँ पे कोई सर्जिकल टेक्नीशियन नहीं होता जो कि मेरे साथ हेल्प करे. मोस्ट ऑफ द टाइम मैं अकेले होता हूँ. मैं कॉल करके पैसों पे बाहर से बंदा मंगवाता हूँ, उसको मैं पैसे देता हूँ कि सिर्फ सर्जरी में मेरे साथ असिस्टेंट करके खड़े हो जाओ. ट्रस्ट मी, ये डेली मेरे साथ होता है. हम रिक्वेस्ट करके लोगों को बोलते हैं कि यार आपको मैं सिखाऊंगा, आपको मैं पैसे भी दूंगा, मेरे साथ खड़े हो जाओ, मैं ऑपरेशन करता हूँ. सो मच वी आर डिफिशिएंट. फीमेल तो बिल्कुल मिलती भी नहीं है, मेल भी नहीं मिलते. और पेशेंट्स हमारे इक्वली फीमेल भी होते हैं, मेल भी होते हैं. वी नीड असिस्टेंट्स, वी नीड टेक्नीशियंस, वी नीड सर्जिकल टेक्नीशियन, वी नीड nurses. So this field is very much needed. A lot of requirement is there. As Professor Zisab said that millions of people are required worldwide. If you get perfect skills and if you are qualified for those, you can apply anywhere. Inshallah, you will not be jobless. All over the world as well as in Pakistan, you have got very good future. The only thing is you should love your profession. You should be perfect in your profession. You should be skillful. Whatever you do, if you are a technician, you should be a perfect technician. You are a surgical technician, you should be a perfect one. If you are a nurse, you should be a perfect one. Then every center will request you, they will hire you. Because if I am a surgeon, if Dr. Ehsan is a surgeon, Sir is a surgeon, they are, once you do a case with them, I will know that this man is a perfect technician. He assisted me so well, he has kept the sterilization so well, he is looking after the operation theatre so well, he is doing dressing so well. I will pay you more than any other person who is not trained. I will request you to come to my center, to my hospital and work with us. Similarly, every center, every surgeon, they need you. Right? Thank you very much.
Thank you, sir. Now I would like to invite our respected guest, our respected deputy director, our respected focal person for cutting the cake. Today is 25th May, so I invite on the behalf of Vice Chancellor speech Dr. Atiq Qureshi, PhD, Biochemistry and Microbiology, Associate Professor, on the behalf of Vice Chancellor.
First of all, respected distinguished guests, respected faculty member and dear students, Assalamu alaikum. First of all, on your special day of Global Surgical 25th May, I would say as a biochemist and PhD in my subject, almost I teach to all the discipline, and biochemistry is also the part of medical college, part of every technology and part of every discipline of allied health sciences. So on this day, first of all, I would like to motivate you people, and then I'll come to the Shodai Takreem. As you know, you all are the students of allied health sciences and you are the part of medical profession. Once you are here and once you get your degree, you join the professional career and you will be the part of medical fraternity. And of course, I think every medical professional, it is the natural instinct of every medical doctor and technologist to serve the humanity. So once you serve the humanity, so you are the true heroes of the society. As we have seen in the COVID-19, which is a global pandemic, so all the medical professionals played their a key role, so they are the true heroes. Now, World Surgical Day के इस मौका पर वाइस चांसलर सरहद यूनिवर्सिटी पेशावर, तमाम असातिज़ा, तमाम स्टाफ की जानिब से آپ سب کو مبارک دیتا ہوں۔ آج کا دن آپ کی زندگیوں میں اہمیت کا حامل ہے، تاہم آج کے دن یعنی 25 مئی کو وفاقی اور صوبائی سطح پر یوم تکریم شہداء بھی منایا جا رہا ہے، جس میں تمام شہداء کو ان کی بیش قیمت جانوں کا نذرانہ پیش کرنے کے لیے خراج تحسین پیش کیا جا رہا ہے، اور ساتھ میں ان کے خاندانوں پسماندگان کے ساتھ یوم یکجہتی بھی منایا جا رہا ہے۔ چونکہ میڈیکل کا شعبہ ہمارے لیے باعث عزت اور تکریم ہے، اور اس سے وابستہ افراد جنہوں نے کووڈ-19 کے دنوں میں بھی فرنٹ لائن ڈیفنس کا کردار ادا کیا، لہٰذا آج کے اس موقع کی مناسبت سے ورلڈ سرجیکل ڈے کا انعقاد کا فائدہ اٹھاتے ہوئے سرحد یونیورسٹی کی انتظامیہ کی جانب سے ملک کے لیے جان دینے والے تمام شہداء، چاہے ان کا تعلق آرمڈ فورسز سے ہے یا میڈیکل کے شعبہ سے ہے، کچھ سنہرے الفاظ میں خراج تحسین پیش کرتے ہوئے ان کے خاندانوں کے ساتھ اور پسماندگان کے ساتھ دل کی گہرائیوں سے یکجہتی کا اظہار کرتے ہیں۔ سرحد یونیورسٹی ہمیشہ ان کے بلند درجات کے لیے دعا گو رہے گی۔ ملک کی سرحدوں کی نگرانی کے سلسلے میں ان کی جانب سے دی گئے قربانیوں کو ہرگز نہیں بھولے گی، اور ساتھ میں وہ تمام ڈاکٹرز، پیرامیڈیکل سٹاف بھی ہمارے لیے اتنے ہی قابل تکریم ہیں، جنہوں نے مشکل حالات میں پاکستانی عوام کی خدمت کی اور اپنی جانوں تک کا نذرانہ پیش کیا۔ سرحد یونیورسٹی زندہ باد، پاکستان پائندہ آباد۔
So now I invited our respected Deputy Director to come on stage and present shield and gift to our respected guest. The first shield goes to Professor Dr. Salim. Second one goes to Professor Dr. Nadir Shah. The third one is Dr. Ehsanullah. Fourth one, Dr. Azizullah Wazir. Next one, Dr. Aliman Shah. The next one is our focal person, Mr. Zarak Khan. Next one is Assistant Professor Kamran Shah.
اب ہم جو اسٹوڈنٹس ہیں جنہوں نے اچھی پارٹیسپیشن کی ہے ان کو سرٹیفکیٹس دینا چاہیں گے پلیز۔ فرسٹ سب سے پہلے جو ہمارے پاس مین آرگنائزرس ہے پروفیسر ڈاکٹر نادر شاہ اینڈ پروفیسر ڈاکٹر احسان سر، پلیز آپ بھی ساتھ دیجیے۔ سب سے پہلے ہمارے پاس جو مین آرگنائزرس ہے کیسر خان، پلیز کم اینڈ ریسیو یور سرٹیفکیٹ۔ مظہر رؤوف، ارشد احمد، صابر خان، شاداب اینڈ ہز ٹیم، two students who have done all the program, Miss Amara and Mr. Shahab. Farishta and her team. Jamal from second semester. Ataur Rahman, second semester. Qasim Shah, fourth semester. Salman Khan, fourth semester. Mr. Umair, fourth semester. Miss Khushnurs. Mr. Rahim, 4th semester. Miss Iman, 2nd semester. Miss Ariba, 2nd semester. Miss Asma, 2nd semester. Miss Zainab, 4th semester. Jawad Roghani, 4th semester. Riaz Ahmad, 4th semester. Qasim Jan, 4th semester. Daniel Khan from 4th semester. Salman Khan, 2nd semester.
Respected sir, I am really very thankful to all of you to spare his precious time और इंशाल्लाह फ्यूचर में भी हम ये सिलसिला जारी रहेगा और वक्तन फ़वक्तन हम आप लोगों को बुलाएंगे. Thank you so much.